In this module, we are going to look at living with stroke and touching on emotions, roles, and relationships. There are a wide range of emotions that you may be feeling. Some of these emotions are anger, sadness, grief, and loss, the loss of abilities, loss of independence, and loss of control. Other emotions may include feeling anxious, overwhelmed, the feeling that you're unable to cope with all of the changes and adjustments after stroke. In this module, we will talk about anxiety, anger, depression, and hope. We all experience anxiety in different ways. For some of us, anxiety can look like worry, worrying about the future, worrying about what will happen to you and your family, worrying about how well you will recover, and the fear of having another stroke. All of this anxiety and worry and fear can interfere with sleeping. Anxiety can also be experienced as feeling more irritable than your usual self, feeling angry, or having trouble concentrating. It is normal and understandable to experience anger with trying to understand and adjust to the changes and losses because of your stroke. However, intense feelings of anger can interfere with recovery and your well-being. When the anger feels overwhelming, it is helpful to find positive ways of what to do with all of that anger. It is helpful to look at what are the reasons for the anger. Once we understand the reasons for the anger, we can then start looking at possible solutions. It is also helpful to find ways to let the anger out. Crying is a good outlet, as it lets some of that emotional pressure come out. Some people feel like yelling and screaming, which is not easy to do when you're in a hospital. Some use laughter. Some find it helpful to talk about what they are going through. Frequent and intense feelings of anger can affect your recovery. It can also have a physical effect on your body, like increasing your blood pressure. If you notice that you are having frequent and intense feelings of anger, reach out to your care team. This could be your nurse, rehab team, doctor, or social worker. Depression is very common after stroke, for the stroke survivor and for their caregiver. As high as 30 to 60% of people report feeling depressed in the first year following their stroke. A third of caregivers can also experience depression. It is important to be screened for depression, as it can impact your recovery and well-being. These are symptoms of depression to keep an eye on. Depression can look like decreased motivation, having less enjoyment of life, having trouble making decisions, and poor concentration. Changes in appetite, with some reporting a loss of appetite or an increase in appetite. A change in sleep, with some sleeping more than their usual, or having interrupted sleep and having low energy and fatigue. Some stroke survivors wonder about their quality of life, finding purpose, and some have thoughts of whether they would be better off not surviving their stroke. Depression is more than just feeling sad. Depression is not just unhappiness or a bad day. Depression is a real condition with a biological basis in the brain. Depression is a normal reaction to a major life change, and depression is not a sign of weakness. With some stroke survivors, there may be depression and pain as a result of their stroke. Pain can cause or worsen depression, and depression can worsen your pain experience. If you are having pain, let your care team know. Caregivers can also experience depression. Caregivers are also experiencing major life changes when their loved one has had a stroke. Caregivers may experience emotions similar to the stroke survivor, as they are taking on new roles and responsibilities. Fortunately, there is help. If you have symptoms of depression that persist for 2 weeks or more, speak with your healthcare team. Depression can slow your recovery, while treating the depression can help you with your stroke recovery. Once depression is diagnosed, there are helpful ways of treating it. One way is with medications, known as antidepressants. In addition to medications, there are also other strategies that can help with depression and mood changes, like staying engaged in activities and hobbies, socializing with friends and family, and staying as physically active as you can. There are also some great support groups in the community for stroke survivors and their caregivers. It's important to set goals and work with your rehab team to help with your stroke recovery and improve your self-confidence and self-esteem. Learn as much as you can about the type of stroke you had. Talk with your healthcare team about any concerns and questions that you have. Following a stroke, stroke survivors are dealing with changing roles at home, in the workplace, and with family and friends. As part of changing roles at home after your stroke, you may need help with meals, grocery shopping, and maybe even with banking, and you may need someone else to help with driving. Your stroke may also affect your ability to return to work, or you may be able to return to work with work accommodations. If you are off work due to your stroke, ask for the unit social worker, as they may be able to help with loss of income programs and provide information to help with some of your financial worries. After stroke, you may need help with your care. Usually someone close to you takes on the new role of being your caregiver to help you with different tasks like cooking, cleaning, and getting dressed. Some caregivers may be struggling with their new roles and responsibilities, and they try to do everything by themselves. This can place a caregiver at risk for depression. With these new roles and responsibilities, caregivers may feel frustrated, helpless, overwhelmed, depressed, afraid, angry, and at risk of burnout. These emotions are normal and understandable. It is important for caregivers to take some time to rest and take time to care for themselves, whether going for walks or engaging in activities that they enjoy. Both the caregiver and stroke survivor can receive support from different services in their community. Maybe it's your local religious leader or a friend to talk with, seeing a counselor, or joining a support group. To help caregivers with their new responsibilities, are there friends, family members that can help share the workload? Are there activities that the stroke survivor can do together with their caregiver? It is also helpful to check to see what support services are available in the community. Home and community care have support services like a personal support worker coming to the home. There are also meal programs like Meals on Wheels, RVH Frozen Meals, and Heart to Home meal plans. There are also private pay support services to help with dressing, meals, and cleaning. For those who can't drive as a result of their stroke, there are transportation services that may help, like the Red Cross Transportation Service, the BATS bus. Wheelchair taxi services are also available. Also remember to ask about emergency response systems if your loved one lives home alone or is home alone for a few hours. The care team encourages caregivers to ask questions and learn as much as you can about your loved one's stroke, to learn how to participate with their rehab goals, and to ask us about caregiver services. Remember, recovering from a stroke takes time. A stroke can affect your roles and relationships with the people around you, with your spouse, your partner, with siblings and children, with family and friends. After stroke, it is important to maintain your social relationships. However, people may reduce or even stop their social activities because they cannot do the things the way they used to. But if you are willing to make some changes, you may be able to continue with your social activities and the things you enjoy using some planning and creativity. Ask your rehab team for some suggestions to help with how it can be done. If your stroke is affecting your speech, it may be difficult to communicate with too many people at once. Use some planning and creativity. Meet with one friend or a few friends at a time. Your care team may have also recommended communication tools to help. If your mobility has changed as a result of your stroke, what places can you visit using your walker or wheelchair? Check to see what transportation services are available in your community for people using walkers or wheelchairs. With planning and some creativity, you can find activities to do with family and friends. Check out what you can join at your local community center that is accessible by wheelchair or walker. If you were attending your local community place of worship or want to attend one, look at how you can plan this. There are also some stroke groups for the stroke survivor and their caregiver that offer support, resources, and social activities. Remember, for most, your stroke recovery continues outside of the hospital or rehab program. Lastly, it is important to have hope as you go through your stroke journey. What we hope for often changes over time as you learn more about your new normal. Accepting yourself after stroke does not mean that you have given up hope of improving. Planning, using creativity, and changing the ways you do things to accommodate your needs does not mean you have given up hope. Thank you for taking the time to learn more about emotions and changes to roles and relationships related to stroke. Remember, it's important to reach out to your healthcare team if you have any questions or concerns. The following websites were used in the development of this module. You may find additional information on these sites.